Today, or this month rather, September is National Suicide Prevention Month. And to talk about this very important subject, we're delighted to welcome a familiar guest back to Midday, Dr. Ronsalind Clark with RiverValley Behavioral Health. Doctor, thank you for being with us. This month,
Thank you.
It's really a perfect time to discuss this very serious subject, isn't it?
Yes, it is. September is National Suicide Prevention Month, and many local agencies are engaging in a lot of awareness and remembrance activities. Suicide is the 10th leading cause of death in the United States and the second leading cause of death among young people aged 15 to 34. Individuals expressing suicide often fall through the cracks. Suicide may come on rapidly, and it is very difficult to predict.
What are some of the risk factors that we deal with?
Well, Mike, some of those risk factors are gender. 3 times as many women attempt suicide, but men, because they choose more lethal means, are often more successful. Age plays a factor, as I mentioned, about the adolescents. Older adults are also at a high risk of suicide. White males over the age of 65 who have lost a spouse are at a particularly high risk. Individuals living with chronic illness and pain issues, having a mental illness or having depression puts you at more risk. Not having a good social support system around you. And of course, if you've had a family member have a suicide attempt or completion and a previous attempt on your part, having an organized plan, these are all putting you at a higher risk.
I've had many people who've had, unfortunately, a suicide in the family, and they say, boy, if we had only known. What are some of the warning signs, doctor, that people could be aware of?
Threatening to hurt or kill yourself, seeking means, access, getting ammunition, getting a gun, stocking up pills, talking about suicide on social media and posts, withdrawing from family or friends, individuals who have a feeling of hopelessness, lack of purpose, they feel like they're worthless, engaging in risky behaviors, beginning substance abuse or increasing that substance use, driving faster, wanting to do crazy, risky type activities, and depression puts someone at a much more sudden feeling towards suicide.
Final question. What if someone has a pretty good idea? I think he or she is suicidal. What's the first thing they should do? What is 1 or 2 things they should not do?
They should not keep it to themselves. If they are feeling suicidal, reach out and have someone to talk to. If you are that person that they end up talking to, make sure you know that they know that you care and that you are willing to help them. Never leave them alone. You have to ask the tough questions. You have to ask, are you having thoughts of suicide? Are you thinking about killing yourself? Don't ask them things like, you don't want to hurt yourself, do you? That gives them a way out.
Got it. Doctor, best way very quickly to get hold of RiverValley Behavioral Health and to get hold of you.
Our crisis line is always answered, and that number is 800-433-7291. If someone is having a thought of suicide, they can call the National Suicide Hotline and talk to a caring professional there. That number is 800-273-8255.
Dr. Ronsalind Clark with RiverValley Behavioral Health. Doctor, as always, thank you for your expertise.
Thank you, Mike.
You bet. And we'll talk with Russell and Woods when we come back.